I'm Tim Rawson. I'm a clinical senior lecturer in infectious disease and antimicrobial resistance at Imperial College London, United Kingdom. My research focuses on the development of clinical decision support systems and tools to optimise antimicrobial prescribing. Clinical decision support systems, or CDSS, are electronic tools which help healthcare professionals or patients make decisions about their healthcare. From an antimicrobial prescribing and diagnostics perspective, clinical decision support systems can be quite broad and they can be enacted across the decision-making pathway, all the way from the making of a syndromic diagnosis through to the prescribing of an antibiotic, through to cessation of antibiotic therapy. If we think about clinical decision support systems and how they can support the laboratory, I think there are several areas to consider, both pre-analytical and post-analytical. If we focus on the pre-analytical area, clinical decision support systems have a range of roles, including helping get the right sample in the right patient at the right time, often called diagnostic stewardship, as well as making sure that the clinician orders tests in an appropriate fashion. From a post-analytical perspective, artificial intelligence is also providing a potential for us to learn from diagnostic information and improve the requesting and interpretation of results in a much more efficient fashion. For example, artificial intelligence is now being applied to genotypic information to infer organism phenotype. This means that potentially we can deliver more appropriate antibiotic therapy earlier for our patients, and as molecular diagnostics become more established, will mean that potentially we are not as reliant on phenotypic, culture-based diagnostics in all cases. As we continue to understand the role of artificial intelligence for interpreting data from diagnostics, there's a circular benefit to this in that we can feed this back into the pre-analytical processes to further optimise diagnostic stewardship for the laboratory. Clinical decision support systems can empower the laboratory, particularly from a microbiological perspective, by helping optimise diagnostic stewardship. That means that clinical decision support tools help clinicians order the right test for the right patient at the right time. It can help us ensure that the right labelling is placed on specimens, and also it provides a way of us having oversight over the requesting of samples at a systems level. Furthermore, by embedding diagnostic stewardship within clinical decision support systems, it means that we can rapidly identify areas and provide feedback to clinicians or teams when we identify problems with stewardship occurring early. The impact of deploying these systems within the hospital is that we can optimise the diagnostic stewardship process. This means that the laboratory receive high quality samples and it gives us the best chance of getting a diagnosis for the patient in a timely fashion. Furthermore, it reduces the risk of sending inappropriate samples, which can lead to problems such as contaminants, which can be difficult to interpret and lead to inappropriate treatment of the patient. As well as generating impact for diagnostic stewardship, integrating diagnostics and the laboratory process into clinical decision support systems provides a way for us to develop indicators and ensure that we can monitor processes moving forwards across the laboratory and in the hospital. These systems can also have impact at the systems level in helping us provide surveillance from a stewardship perspective. For example, it allows us to generate indicators that we can then track over time. It allows us to think about ways of putting in place audit and feedback mechanisms when we identify challenges, and allow us to address stewardship at both the hospital level as well as at an individual prescriber level. The key messages are that clinical decision support systems can help support diagnostic stewardship for ensuring that the right test is requested for the right patient at the right time. Furthermore, as laboratories decentralise and we continue to adopt molecular diagnostics and point-of-care testing, clinical decision support systems will offer the ability for us to be able to help support clinicians make optimal decisions based on those results. As we continue to develop and integrate artificial intelligence into these systems, it's going to provide us with the opportunity to be able to utilise diagnostic data to determine antimicrobial susceptibility and bridge that gap between syndromic diagnosis and the availability of our diagnostic information.